Hi, I'm Rod Rohrich from Dallas, Texas. Welcome back to Rohrich Knows Podcast. The business of medicine. How do you start a practice? Wow, you know, the most amazing thing is you're taught none of that in medical school. You're taught none of that in residency. And where do you have to learn it? You have to learn it yourself. Well, I have the privilege of knowing Jordan Frey for how long have I known you? When he's a resident at NYU, then as editor of the Journal of Plastic and Reconstructive Surgery, the best and the most widely read journal. He was our ambassador for several years, and he's a rock star. Now, he practices what he preaches, and he's done it in Buffalo, New York. So welcome, Jordan. How are you?
Thanks, I'm good. Thanks for having me. And yeah, no, it's been all my pleasure, having you as a mentor for all these years.
It's amazing. Well, I mean, it's easy to mentor somebody who's a rock star from NYU, board certified plastic surgeon. Congratulations, Jordan.
Thank you.
Awesome. He's incredibly well trained plastic surgeon, micro complex breast reconstruction. So tell us about, and then you're the founder of the Prudent Plastic Surgeon, and I want you to put a plug in for that at the end as well. Okay, I mean how we can get a hold of you. So tell us about your journey from being at one of the best plastic surgery training programs in the world, and this is about everybody. You know, we're not trained in medical school and residency to do any of this stuff. And so, how do you start your practice? I mean, and why did you go to Buffalo, New York? I mean, I love it. I'm in Dallas, Texas, in private practice from New York City.
Yes, and I'm originally from Buffalo, so that's a big part of the equation. But
you went home. You went home.
Yeah, never expected to be back. To be honest, for the longest time, I expected to stay in New York.
Well, they're lucky to have you, man. They're lucky to have you in
thank
Buffalo.
And so it's been interesting. And like you said to begin, we don't learn any of this stuff in terms of building a practice. You kind of go through residency, and obviously these cases are fed to you because you're working with your attendings, and then you get out and you kind of expect like, okay, I'm going to get out, and we all train at great places, but especially you train at some of the really big places like in Texas or New York, and you kind of just expect, well, they're just going to come and find me, the patients, and that's not really the way it works, obviously. And so
it's not the way at all, as you know.
Yeah. There's nuances depending on what your practice type is, but you have to go out and you have to kind of make things happen for you. You have to get your name out there. You have to get to know refers, and I think the challenge really comes in that when you initially come out, you're just so eager to start practicing and to have your own patients and to care for them and offer them the skills that you've worked so hard to acquire. So you kind of just go out without a plan.
Yeah.
And
like a ship without a sail, right?
Exactly.
So
and because of that, I see.
So how did
go ahead.
How did you do that then from NYU to Buffalo? I mean, when you decided with your wife, we're going back home, so you said, oh my God, what are these 10 things? Tell us your journey.
Yeah, what I focused on, as silly as it sounds, I had an Excel spreadsheet where for every job I was considering, I wrote down a lot of the things that were important to me about the practice that I was going into. Things as basic or obvious as like what is the call schedule, like what is my initial salary, what's the potential salary, but then also just things like how is there a need for the cases that I want to do. So I love breast and breast microsurgery. Right. So going to Buffalo, amazingly, there's no one doing breast microsurgery there.
Unbelievable.
So doing that, and then once I sort of identified and established the niche that I wanted to go into and the need for my services, then it really kind of went into how am I gonna sell the practice that I want to my employer first. I'm employed. I'm not in private practice, but it would be a similar type of thing.
Sure.
Going into private practice. But I wrote my 5-year vision for what I was going to bring to the community and my employer, and the 10-year vision, and sold that to them so that they supported what I needed. So that meant buying a microscope, getting special instruments and things to do lymphatic surgery to really kind of bring a whole breast microsurgery practice into an area that hasn't had it. So you really want to be thinking ahead of what you want, and from day one be building towards that.
Yeah. So basically, if I can summarize, Jordan, you had a vision, you had an Excel spreadsheet, which I'm sure you're going to share with us on what you asked for, what you wanted, what you aspired to, and then you actually had a strategic plan, a 3 and 5 year plan of what you wanted to do. I think that's brilliant, and that really kind of summarizes kind of who and what you are. That you think things out and you just don't go ready, aim, fire. I mean, you got to plan. You got to plan it.
Yeah, I think that's really important. And I think the other thing that I see people get caught up in a lot is when you first start out, your practice is not going to be what you want. Everyone wants to go out and every person who wants to do rhinoplasty wants to go out and have your practice right from the start. But you didn't. That's not how it worked. You built up from the ground level, and so you have to expect that too. And you can't get discouraged at first if things are slower or not exactly what you want. You want to constantly be taking those incremental steps to your perfect practice.
That's 100%. I mean, I'm a hand and a microsurgeon and craniofacial surgeon, and I did all that. I did craniofacial, hand, micro, Mohs surgery, breast reconstruction. I did all that before I now do face and noses. And of course, you're right. Today in this instant society, people want it immediately because they want to become social media stars, right? So tell me how you did that. Okay, so you had the plan, and obviously your hospital system loved it, and you've thrived in it. So tell us a little bit about that part of the journey.
Yeah, so it didn't start out totally smooth. So I went in, I wanted to establish this breast microsurgery practice, and I was coming into an area where that just wasn't done. And so I came in, I met with all the breast surgeons. They were currently very happy with their reconstructive surgeons and implant surgery, and saying, well, this is working, and you know what, I can do a bunch of implant cases in a day, and it doesn't throw my schedule off and all this. So I just say, I understand, this is just something I'm offering. If I can ever help, please let me know. I went for 6 months. I would go to the breast tumor board and multidisciplinary meetings at different hospitals, and no referrals
None.
to me, etc. And in the meantime, I was doing other stuff. I was doing body contouring. I was doing wounds, lower extremity wounds, flaps, etc. I was kissing a lot of frogs and just sort of getting my name out there. And then eventually, I had some of the breast surgeons or the other plastic surgeons just send me,
impossible
really
cases.
challenging disaster cases. The patient that's been radiated, had a tissue expander, it failed, infected, all of this stuff. And I took that and said, okay, this is really an opportunity that I can show what I can offer. And so helping those patients through and giving them, a really nice reconstruction in a difficult case. And so then they start to see, oh, okay, this is what he's able to offer. And just demonstrating that, these cases aren't taking 12, 18 hours. I'm able to do them in 6 hours. The patients are able to go home in a few days, and all of a sudden they start sending me more and more, and it's just snowballed to now where, 3-4 years out, I'm mostly just doing immediate reconstructions and really the ideal kind of cases in practice that I'm looking for and able to help the community in a new way. And so it looks, if someone looked now and saying, they wanted to do something similar, it would look like, oh, well, it's really easy to get that finished product, but it's a lot of work.
Jordan, you empower the passion and the desire to be patient, but stay focused on the end goal. So I see and hear in you the passion and desire and the end goal. And, of course, am I surprised by that? Absolutely not, because all of us are filled with, have faced all of those things. I mean, I didn't do, 8-10 noses a week, until the last 10, 15 years, but I worked hard at it. And, you always are attracted to things that you're great at and love to do, and you become the best at them. And that's how you become an expert. Nobody's ever become an expert at things they don't like to do, right?
Exactly.
Whether, you don't say, gee, I'd love to do pressure sores. Well, okay, maybe. But so I think that's an incredible story. But it took 3-4 years, right, to get there.
It took time, yeah, and a lot of concerted effort. And it is funny, like you say, we never know where any one random encounter is going to take us. And so it was unexpected things, or taking care of some patient that, got a laceration, and then all of a sudden they want breast reconstruction, or they know someone else, or, so all of these things. And it's true, those 3 A's of affable, available, and able. Right. That's the biggest thing. And again, all of that within the framework of working towards your ultimate goal, which you have to have in mind, because again, you can do all those things, and if you don't have an idea where you're working towards, then it's kind of easy to get off course. And that's where I see some people getting to a point of burnout, or where they're really not happy with their career because it's not where they want to be, despite being busy and doing things that from the outer perspective may seem like, oh, they have a great practice, but just it's not what they want. Right. So I think all of those things within that framework.
Right, and you're doing what you want to do, what you're trained to do, and what you love to do, and that shows. Because so many people, Jordan, in medicine, I would say 80% of physicians aren't happy. And in plastic surgery, it's probably flipped, because we all love what we do. I'm honored to go to work every day because I don't really work, because I'm doing the things I love. And I can see you're doing the same thing. And, you're doing it in breast reconstruction and the things you love to do. But it takes a lot of work. You're focused, you're passionate on your goal. And yeah, are there failures and stepstones on the way? Absolutely. And you just have to keep going, and
Exactly.
I think, Winston Churchill said it best when they asked him during World War II. He said, what happens when you're failing? And he said, you just got to keep getting up and keep running, and you got to keep moving. And that's so true. And so what thoughts do you have that you can share with the viewers, and really the young physicians, and actually not just plastic surgeons, on what are the 3 things that they should do when they're faced with this today? And my fellows are saying, I don't know if I can find a job. I may have to do it by myself, and I don't know anything about this. So what are the 3 key thoughts that helped you succeed? I mean, obviously, I want to say you're unique, and you are, but, you're unique because you've stayed focused on your goal. So what are the thoughts that you have for the viewers?
I think the biggest things that helped me, if I distill it down into 3, one is create a vision of what you actually want from your practice. We usually go out and say, okay, what jobs are out there that I can fit myself into? But you want to think broader than that. You want to say, okay, what am I looking for in a job, rather than the other way around? And you really want to define that well.
Right. So your vision of where you want to be.
Exactly. Yeah. That's number 1. Number 2, I think you have to go outside of your comfort zone, or I guess I should say most people's comfort zone. It certainly was mine. The job I ended up at wasn't listed. That was from me reaching out and cold calling. Right. Pretty much all of the opportunities I ended up really considering were quote unquote cold opportunities. So you have to, if you identify a situation that you think works for you, be aggressive, not obnoxious, but aggressive in pursuing it, even if it's not advertised, because most of the time it won't be.
Right. So embracing the unknown and uncertainty, if it's going to be your destiny. Okay.
Exactly.
That's number 2. Okay.
That's number 2. And then I think 3 in the beginning is that be within the context of working towards your vision, be able, affable, and available. And I said it before, but I love that phrase, and I use it all the time. But you got to kiss a lot of frogs. So get ready to kiss a lot of frogs, and relish that process, because it's leading somewhere, rather than looking at it as some failure, or, oh my gosh, my first year, I haven't built my ideal practice yet.
Right. Well, to me, that number 3 is stay positive, stay focused on the goal, and as you say, kissing the frogs. But really, on that goal, you've got to follow and live your dream, and you're doing that. And the only way to do that is to stay focused and passionate on that. Otherwise, people fail. And if you don't do that, and if you really like this, you're going to love my next session with him, and we're going to talk about how you get there using a business plan and to doing it the right way and incorporating business tactics into the art of science of medicine with Dr. Jordan Frey. So thank you so much, Jordan. That was amazing advice, and I think it's inspiring for people to hear that, because they know that you have done it, and of course, you've really done it because of your passion and your incredible skill, which I think you didn't mention, because doing the things that Jordan does are very complicated, and there are not that many plastic surgeons that do that. And the great thing is, if you do that and you're selfless and you are humble, others will embrace you. And I'm sure that other plastic surgeons love that, because they're sending you their complicated cases. Is that not true?
Yeah, and it's fun, and again, it's such a great community within plastic surgery and just medicine in general.
Right.
And especially when people like yourself as well are very passionate about it and just looking to help patients. So that's what makes it so much fun.
Yep. Well, that's the art of what we do in plastic surgery. So, helping you become a better you. And Jordan, you amplify all of that. So, send us your comments, and look forward to visiting with Dr. Frey for his next one. We talk about the prudent surgeon. Thank you.